as you can see, I actually had a new assistant dean who had to leave me a message, and it was Susan DVM, and I walked in and was like, do you know you are a doctor of veteran medicine? I had never thought about it that way because he just put all of the capital letters from my last name together as DVM. So now I just have extra credentials. I was asked to present on credentialing during a meeting with some of our colleagues in the committee. We're talking about credentials and what is beneficial, what isn't beneficial, what would be really good to talk on this. And I thought, well, I'm really looking at these myself. I'm a non-traditional student. I was a social worker for 13 years before I decided to go back to school to be a pharmacist. And in those 13 years, I did a lot of different advocacy, a lot of different types of work. And I wasn't sure exactly what I wanted to do as a pharmacist, except for I knew I wanted to counsel patients. And so when I became a pharmacist and did my residency, I knew that I wanted to do something different, but I wasn't exactly sure what set of credentials I would want and what I would need so that I could do a lot of counseling with patients. So when we were talking about this, I said, I'm really looking into this, and I'm really excited about this discussion. And then they said, well, would you like to present because you are researching this? So with that said, I just want you to know that we're going to talk today about the advantages of credentials, different types, and then I'm going to explain. And there's a lot of details. So those that were up at 4:30 this morning or couldn't sleep last night, it's a lot of information, it's boring, and we might have to call somebody up on the side to dance. But because I don't have extra credentials, I just want you to know that I am not an expert. I don't have a lot of information besides all the information that I have completed today. If you have additional questions, I am more than willing to share all of the research that I have completed for today, but I may not know every single answer to the questions. But I want to go back just for a second to tell you about what my credentials were. So it was Susan DVM, so Denise Miller, because of my capital letters. Then I have a BS. I have a bachelor's degree in sociology and family life. I have a PharmD, which everyone knows. I have a CIP, which is I'm a certified immunization pharmacist. And I'm NDPP, which is an accreditation through, or a certificate that I obtained through the CDC on the National Diabetes Prevention Program. I also have taken the MPA rapid diagnostic testing, which we'll talk about today. So I have lots of letters, but it's only relevant to certain situations. Why do we get credentialed? Credentialing or creed or credence, they're all derived from the Latin verb credere, which means to trust, to entrust, or to believe. And as pharmacists, we are entrusted with healthcare needs of many of our patients. And so it's very important for us to realize that the credentials that are behind our name are very important. And there are many different kinds of pharmacists. We have nuclear pharmacists, we have oncology, psychiatric, point of care pharmacists. Are there any other types of pharmacists in the room? We have hospitalists. Any other specialties? None? Well, maybe after hearing this presentation, you will go to get a specialty. I do have some examples. So Jeff Bates is one of my colleagues. He's a PharmD and a CGP. Does anybody know what a CGP is? Certified Geriatric Pharmacist. So William or Bill Green has a BS Pharm, PharmD, BCPS, and FASHP, which we learned earlier what FASHP was. Does everyone know what all of them are? So we're feeling pretty comfortable, good. Julie Gropey is a PharmD, CDE, Certified Diabetes Educator. And then Jill Bates has an MS, PharmD, and BCOP. Her MS is a Master's of Science in Biochemistry and Biophysics, and the BCOP, Oncology Pharmacist. Good. So it sounds like a lot of people know what these credentials are. Has anyone ever attended a session or a presentation where there were just so many letters behind a person's name that you weren't sure what they were or why it was there. Right before our meeting, or before the presentation, one of my colleagues says, "What are all of your credentials?" So she didn't even know exactly what everything was, and she knows me fairly well. Why do we have so many credentials? Well, residents, after a year of residency, you may want to run far, far away from getting additional trainings, but you may also need to look at some credentialing, which we'll talk about some options today. Incoming residents, what are your future goals? Today we talked about plans. Earlier today with Manette, there was the goals and what does your future look like? What credentials are you looking at? Preceptors, why do you have the credentials that you have? Have you thought about why and what do you do with your credentials? So I would like you to take a moment because just like Jamie said this morning, we have a path and we need to really talk to others to find about their path to help us determine our path. So I'd like you to take a couple minutes and talk to maybe somebody that you don't know and ask them what their credentials are and why they took that. Why did they take the path that they took? So this is active learning. Talk amongst yourselves. I want lots of letters. I want so many letters. I want every letter of the alphabet. Can you bill under that?
I'm a VA, so
it doesn't matter.
No, you can though.
Ms. Davis, anyone have anything else other than that? Jackie, do you have any credentials besides that?
PCPS, and for similar reasons, as a state up there and being in academia.
Anyone else have any other credentials here? So we have lots of opportunity for you guys to learn today then about these credentials. Well, ASHP stands as that pharmacist's expanding role will enable healthcare workforce to address the primary healthcare needs of patients. Credentialing and privileging for the pharmacist will be an important role as pharmacists become more of their providers, especially in ambulatory care. Quick overview. We go to school to get our PharmD, we get licensed, and then we have options. So our path could be that we decide to work. We could do PGY1. We could go into a fellowship. We could just take some certifications. And when I say just, I don't mean to minimize them. We could do traineeships, post-grad education. And then after that, we also have to make another decision. Do we go into PGY2? Do we work? Do we do certification? Or do we take on another role, credentialing? The fellowships are more research-based, so if you're a research person, then you could go into a fellowship. There are a couple traineeships. The American Society of Consultant Pharmacists, American College of Apothecaries, and ASHP has different traineeships that you can enter into. And pharmacy has a couple post-grad education that are really focused, are the MBA, so you could do it in business administration, also in public health. You could also move on to a PhD, so you could get your doctorate in philosophy and pharmacology, pharmaceutics, medchem, therapeutics, pharmacy practice, and social and administrative services. There's also other post-grad degrees that you could get would be a master's in social work. You could get chemical addiction counselor certification. So there's a lot of post-grad education as well. But how do we make that decision to do this or not to do this? I heard Shakespeare earlier, and I think this is Shakespeare too. To be or not to be, and I use that quite a bit. So to do or not to do. Reasons not to do extra credentialing. Reasons not to go into this extra education might be because you have a job offer. I had an applicant for residency this year that at the very last moment decided to cancel out on her interview with us. And it was because she had a job offer. And she said, I'm afraid that if I do a residency, I won't have a job. So she did not want to have a PG-1 on her CV. Also, maybe someone has a current situation that it doesn't fit with them. Maybe they want to simply work in one setting, or they have a family or another situation that makes it so they don't want to go into additional training or get additional counseling or accreditations. And then some people just don't want to meet those minimum requirements. They feel that it's overwhelming. Remember this morning when we were talking about making sure that you feel confident with who you are? One of the comments was, it's not that we're afraid of failing, but we're afraid of those opportunities. There are times when we are afraid of those opportunities, and we look at the requirement list, and we just become overwhelmed and don't do it. But why do we go for additional credentials? Anybody want to explain any of the to-do list? Reasons to do credentialing? You guys are so involved. I'm really excited. Good thing I have already reviewed my notes. So, developing or enhancing your own self. Advancing your knowledge, advancing your skills, that postgraduate education, and those credentials. For the clinical role, it's expanding. Our healthcare system is expanding. We have greater opportunities to be a part of the healthcare system, to be able to be a provider, and to bill for those services. The complexity of our healthcare. We have persons that are aging, and they are more complex than ever before. And then payer expectations. Payers are not just going to pay people to do the services. They need to make sure that we are credentialed and that we have all the adequate certifications that we need. So credentials are beneficial to many different settings, but I'm just going to go through 3 of them. For the patient, I love that 2 girls, one's the patient and one's the doctor. The patients will want to know that we have the skills and the knowledge necessary to provide the care for them. The healthcare system, when we actually go and submit billing for our services, they need to know that we are credentialed and have the skills and knowledge necessary to provide that service. And then as clinical pharmacists, we have to have a level of experience, knowledge, skills, self-worth, and competence and competitiveness within our own systems. We need to make sure that we can retain the job that we have. Maybe wanting to go that next level. Like Jamie said, do you want to be a clinical services pharmacist? Do you want to be the manager? Do you want to be the director? Do you want to be the dean? What is your goal? And what credentials can get you to that situation? I'm going to go into the really boring stuff now. So if I see someone sleeping, we'll wake you up afterwards. And you can always access the slides on MPA. But the credentials that you can get are certificate trainings. APHA has a lot of trainings that I'll go through. MPA, and then there's a ton of certifications. The American Pharmacists Association has these main credentialing or their certifications. Medication therapy management, you have some pre-work. You actually learn how to counsel a patient, do medication therapy management, all the documentation that goes along with it. And then you become certified, or you get an actual certificate. There's a patient and pharmacist-centered diabetes care, very similar. You have a full day session, and you learn how to care for these patients. You have some after work, and once you submit that, you can become certified. And the pharmacy-based immunization delivery, we have that through the APHA, and MPA also offers that. Yes?
Do any of these, Susan, have an expiration on them, or once you have it, you have it forever?
Once you have these, they're forever. Yeah. Did anyone hear the question? The question was is there an expiration date? For these, there is not an expiration date. For many of the certifications I'll talk about in the next few minutes, they will. MPA has a point of care testing certificate. It started out as a rapid diagnostic, and it's been modified a little bit where they go through a lot of the business model for point of care testing, how you could develop your own business, and then you do some practicing on point of care testing, not just the flu or strep tests, but many different testing. Then they also have a leadership academy. This is a year-long program, and you earn continuing education, but you also graduate from the program and get a certificate saying that you completed this leadership academy. And MPA is working to make it consistent from year to year so that you can learn about how to advance the practice, advance yourself, your leadership skills, and things of that nature. Now, the rest of the certifications that I'm going to talk about do have an expiration, and that's where some of that additional detail will come into play. The Board of Pharmacy Specialties, they are all listed here. The Board Certified Pharmacotherapy Specialist, the Ambulatory Care, Nuclear, Nutrition Support, Oncology, and Psychiatric. There are 2 new ones coming out in 2015, and it's Critical Care and Pediatrics. And so in 2015, that test will occur. So as residents that are just completing their residency year, this is pretty pertinent for you. You need to have a pharmacy degree and licensure, and you have to have experience. You apply before August 1st, and I'm going to show you a picture that the registration is open at this time. And the testing days are from September 18th through October 4th, and there are 200 questions, and it's broken up into 2.5-hour testing, then you can take a break, and then you have 2.5-hour testing to take 100 of the test questions each. And you have to pass this with 500 points. You can take this test anywhere in the United States. Actually, there's a lot of them in the entire world, but it's during that one time frame each year. There are preparatory classes and study groups for you to review this. And once you take the test, you get 60 days, within 60 days, you'll get information saying whether or not you passed it. The board certifications that are specialists or the added qualifications, we have cardiology and infectious disease. And these 2, actually, you take the BCPS exam, so just the normal, regular exam, but then you can apply for the added qualifications after you become BCPS certified. And with that, you have an additional cost, and what you have to do is have a portfolio that you will submit. It is a letter of application requesting that you are qualified for this, and then there's an application form, and you have to be very detailed in explaining what you do to be qualified to get this additional certification. And then you have to have a current curriculum vitae. The pediatric and the critical care will not be available until 2015, so I don't have a lot of information on them. This shows you that you can now register for that exam. The sooner that you register for the exam, the sooner you get to choose your registration date. If you apply now and well, I think you have to wait until after your residency, but as soon as you apply now, you would then get a date in the near future to say that you can select the test. So it's kind of like your authorization to test, where you have to then get choose your date. The persons that registered earlier get to choose their date first. Does that make sense? You can see that there are a lot more certifications. This is showing from when we first started having the BCPS to this past year that we have a lot more people taking the BCPS as well as all of the individual specialties. And then we'll have more information on the pediatrics and critical care in the next year, or actually 2 years. So what do you have to do to get certified? Well, you take the test, and then you get your answer back. And then after that, you have to take your pharmacotherapy self-assessment programs, the PSAPs, and you take them for the continuing education throughout the 7 years. And then after 7 years, you have to have your certain number based upon the different tests that you took. Or you can choose not to do that, as we have a colleague that chooses to retake the exam every 7 years to keep up on that information. The criteria for these tests, the ambulatory care, you can do a PGY1 and have one additional year after that PGY1. And in that additional year, you have to have 50% of your time spent in care. If you don't do the PGY1, so somebody that decided not to, they have to have 4 years of experience with 50% in AM care, or they could have done a PGY1 and a PGY2, with the PGY2 focused in AM care. The nuclear, you have to have 4,000 hours in nuclear pharmacy, with 4,000 of those hours being in training or practice, but you can also have up to 2,000 hours in academics. So you can take a lot of the trainings and certifications, continuing education in that program, and then also take 2,000 hours of the practice. This one has a specialty exam that you have to take, and it's a self-evaluation, a peer review, and formal CE or retaking the test for the recertification after the 7 years. So it's very specialized. The pharmacotherapy, so the BCPS, the one that many of the persons in this room have already had, is the PGY1. So as soon as you complete your PGY1, you are then eligible. Or you can have 3 years without a PGY1, and 50% is in the pharmacotherapy activities. And all of these persons that don't have a PGY1 or the PGY2 have to show exactly what their hours were. It's very specified what the criteria is. For nutrition support, it is a PGY2 in nutrition pharmacy support, or you can have 3 years with 50% in the nutrition support pharmacy activities. So that is very specialized again. The recertification on this was pretty unclear to me, and I don't know anybody who has this certification, whether or not you'll have to take the test after the 7 years, or you can just have a specialized CE that is required. For oncology, it is a PGY2 in oncology and 1 year with 50% in oncology pharmacy, or 4 years with 50% of your time in oncology. So it's pretty intense to become a certified oncology pharmacist. And the psychiatry is very similar to that as well. So 4 years with 50% in the psychiatric activities, or PGY2, and the additional year with 50% in psychiatric pharmacy. And these, again, you have to retake the exam or do the continuing, the PSAPs, after the 7 years. So it's a lot of information. Any questions on that? So some certifications that are not through the board certification. A certified anticoagulation care provider. These are ones that not necessarily a pharmacist. You don't have to be a pharmacist to be one of these. You could be an RN, an advanced nurse practitioner, ND, a physician's assistant, or a pharmacist. And this is a 5-year certification, and the test is offered pretty regularly. You have to be licensed for 2 years and have 750 hours in active anticoagulation patient management within the 18 months before the application. You have to have a written statement regarding your current anticoagulation treatment, and you have to provide a work email address so they can verify that you actually work for the facility that you say you work for. There's a recertification with an exam every 5 years with this one. Then there's the Advanced Cardiovascular Life Support, ACLS. Does anyone not know about this? I can go through it. Most persons in emergency care have to have this, but it is a certification that a pharmacist can get, and it's through the American Heart Association. Accredited and Applied Pharmacology, and this is a credentialing committee will approve persons that are non-physicians. Basically, you have to be a physician, and some pharmacists are allowed. There's a committee that will review your entire portfolio, and if you're not a physician, they will then approve or deny you. It's pretty intense in order to get this, because you have to have a clinical pharmacology training fellowship in order to even be considered. This is offered twice a year, and the recertification is every 5 years. And you could become a clinical lipid specialist, and this is for nursing, dietitians, clinical exercise, psychologists or specialists, PharmDs, and I don't know which one I forgot, maybe the PAs. For a pharmacist, the requirement that we have to have when we're pharmacists is that you have to be licensed, and you have to have a BS or a BA degree in health sciences and 3,000 contact hours demonstrated in clinical experience in the management of patients with lipid disorders. Or you can have a master's degree or higher in health sciences and 2,000 contact hours. Being a pharmacist does not allow you to get right into the program. You have to have that other degree because it's an and with this one. Plus, you have to have a certification by a board, recognized board, so we can have ECPS. Then you have to have a postgraduate training of at least 1 year, relevant academic practice and faculty appointment at a recognized institution, clinical research and scholarly publications, and then you get points for doing certain CEs. Again, a little bit more difficult to get to this one. And I'm finding that the more difficult ones are the ones that probably are going to be more recognized. The ones, there's one in here, I wouldn't any person, and anybody, does even have an age requirement to become certified. So these are a little bit tougher ones. To become a certified asthma educator, it's anyone in healthcare. So any person who wants to MD, DO, PA, nurse practitioner, RN, RT, PFT, which is a pulmonary function, it's a technician for pulmonary function. Certified social worker, PT, OT, or pharmacist. Any one of those persons can take this as long as they have had 1,000 hours in asthma education. It's a 7-year certification, and you just keep retaking the test. For the HIV specialist or the HIV expert or HIV pharmacist, you have this 2-year certification, and there's a limited time each year in the fall in which you can take this test. You have to, for a pharmacist, you have to be licensed in an accredited school of pharmacy. You have to have direct involvement in the care of a minimum of 20 HIV patients. And then you have to have 30 credits of HIV-related CE within 24 months of applying for it. Only MDs, DOs, PAs, and nurse practitioners can take this exam in addition to pharmacists. Other certifications are the pain educator and the pain practitioner. For the pain educator, you have to have a license as a healthcare provider, so basically anyone can take this. And then you have to have 2 years with 4 years with 10% of your time in pain. I thought that was pretty low for 10% of your time to become certified in this. For the CPP, this credentialed pain practitioner, it's a doctorate level healthcare provider, and you have to have 2 years of working experience with people in pain. You get recertified every 4 years, And you have to remain in good standing with your regulatory agencies as well as your professional organizations. Does anybody know anybody who has their PAM certification? Terry does? So we know someone who's gone through that. Other certifications that I found is Certified Specialist in Poison Information. Anyone could take this. It doesn't say that you have to be 18 even, so anyone can take this multiple choice exam. And it's just a certification. And there's minimal information on there, just that anybody can take this test. However, for the toxicology, this is the Diplomate of the American Board of Applied Toxicology. You have to have a doctorate in biomedical. However, even though it said that is the requirement, when I did some further investigation, it said if you don't have a doctorate in biomedical, you can have a bachelor's in health sciences and 5 years full-time in clinical toxicology. And then it says, well, if you don't have that, you can also just work more. So even though it has its requirement, it keeps saying, well, if you don't, then you could do this. And if you don't, you could do this. But for pharmacists, it does say that we have to have a postdoctoral training in toxicology or 3 years of professional experience. And then that's all. It didn't give us any other options. But everyone else has multiple options. This is a certification for every 5 years. I thought it was really interesting to have that because there's so many medications that have interactions. There's Certified Diabetes Educator, which we heard that Kim is certified in that. This is one of the certifications that I was really focused on getting, and I'm tracking my hours. As a pharmacist, we would have to have an unrestricted license, a minimum of 2 years of professional practice, and 1,000 hours of diabetes management, with 40% of those hours accrued in the year before applying. And we have to also have 15 clock hours of continuing education. In order to be recertified, there are also hours that you have to have continuing education as well, and 1,000 hours with your patients. For the board certification, it is a master's degree or higher, and it's every 5 years. With twice a year, it is offered as this. And I was really curious about this, what the difference was. The Certified Diabetes Educator has the National Certificate Board for Diabetes Educators as the responsible agency, whereas the Board Certified Advanced Diabetes Management is the American Association of Diabetes Educators. So it really depends upon what type of certificate you want to have. The CDE is distinct and specialized knowledge in diabetes self-management education, whereas the board certification is advanced level of practice and expertise in the management of persons with diabetes. And you have to have that advanced degree to do that. You can also get a certification as a clinical nutrition support clinician. Registered nurses, dietitians, MDs, PAs, and pharmacists can apply for this. It is offered twice a year, and it's every 5 years you would have to become recertified for this. Going back to a pharmacist only is the Certified Geriatric Pharmacist. It is a 5-year initial certification, and there's 4 testings around the calendar. And you have to register by June 15th if you're going to take it at this time to test in July or August. There's multiple choice questions that go along with it. And for the Certified Geriatric Pharmacist, it really is expected to be, the pharmacist would be knowledgeable about geriatric pharmacology and the provisions of pharmaceutical care to the elderly. No other professions are certified in this one. And you have to be certified with 75 hours of specialized education. And that's for every 2 years. That's a picture of my grandma, which I try to incorporate in every single presentation that I give. is certifications for persons that work in electronic health information. I had no idea, because I am not technology savvy at all, that there are actually certifications for professionals in health electronic records, health information technology, health information exchange, and operating rules administration. And anyone can take these. And I'm glad that there are people who enjoy this type of work, because this is so opposite what I am. There are no specific educational or experiences required. However, you have to have that desire to be a part of the health information exchange technology and the rules, because it is very focused on that. The exams are individual. You have to take a certain number of these exams. And when I was reading it, I thought, I've never heard of anything like this. But we do BCPS, where you go and you take a full day study course. To take this certification, you go to a hotel and you take an exam. So you go in and you take your exam, and you can go back to your hotel room and you go take another exam. And that's how they explained it. It says that they're offered periodically at hotel locations. Thought it sounded a little fishy, but then in continuing my research, you can do some of these courses online as well as take them at these hotels. I thought that was pretty fun. So, which direction should you take? This morning when we heard about our paths, about what to do, which direction should you take? Well, this depends upon you and the directions that you want. Why would you choose one of these? Does anybody want to talk about why they might choose a certification in the future?
You want to know who you're up against for the job that you want and what credentials they have. So credentials really are not only do they make you better at your job, but they also make you more marketable.
Right. So did anyone hear Nancy? Nancy said that basically you need to know what your competition is, what credentials they have, what do they have that you might need to have? What makes them better than what you are? Or what makes you, I know other people who, when they have interviews, they look up their competition. So what is your job future? What is your future for getting a position that you may want? Other reasons. You guys are so talkative.
Can I ask a question?
Yes, Nancy.
So I would like the managers in the room who make decisions, or the program directors that make decisions about who they're going to hire, and ask them, do you look and see if a person who has certifications, how much does it weigh on your decision to either interview the person, not interview the person, hire them, not hire them? Do you even look at it?
So this is a question for someone who is hiring, a manager, director. Do you look at those credentials? Michelle, see your head is. So what decision does that make or influence you?
Because I think it gives you a level of certainty, especially if you don't know a lot about the individual, because maybe they're from out of state or from a program you're not as familiar with. I also think that there are different schools that, pharmacy schools, and I think we have some knowledge base sometimes of how that university ranks maybe compared to others. But then there are some schools that you don't know as much about, or maybe you think you know maybe where they fall, and I think that credentialing can reinforce the qualifications of that individual. And certainly if you have two people and you think they're the same, you're going to take them off the credentials.
Did you guys hear that? Okay, so I don't have to repeat that. Thank you, Michelle. Other feedback? Other leaders?
Yeah, I think it's just a way to standardize someone's qualifications, and I think it's one more piece of education for somebody to have on top of what they already have. I mean, most of us understand what the good programs are across the country, and so this adds that standardization. If somebody hasn't been able to, it doesn't mean that that's. I mean, I think a residency and something like that carries a little more
somebody only with credentials. Like somebody who has a PGY1, for example, with BCBA, versus somebody who worked in the field for 10 years, or 5 years, or how would you balance that from a management standpoint?
Do you understand?
Well, I think every person's different. I mean, if you look at, why do they have 10 years experience and they don't have a residency? So it really gets down to the individual. Because pharmacy's changed a lot in the last 10 years. So somebody coming out with advanced residency and certifications, you have to be much more attuned to what's going on sometimes. Sometimes it really depends on what the other person can do.
And the certifications, are they continuously updating their certification and their continuing education? I know that I had spoken with somebody who owned their own pharmacy, and they said that they had a pharmacist that really wasn't up to date. And she said, well, what were your continuing educations every year that you were supposed to do? They did bare minimum. They did it on topics that were easy. So really take whether or not it's the easy way out or if they're trying to get those certifications. Michelle, did you want to respond to that question at all?
I agree with Mike in terms of, I think, when you start comparing a seasoned candidate with maybe a new graduate or a newer practitioner, you have to sort of look at the whole picture. You would really look at the seasoned individual, what they've been doing during that time period. Like you said, have they maybe done other traineeships? Depending on the type of job, are they publishing? Are they speaking? Are they recognized in that area? Because some of us are kind of old. And, there's some, individuals who maybe, really there weren't PGY2s or there were very few. Or maybe, if you go back far enough, maybe there weren't even PGY1s around, but they're, a very seasoned practitioner. They work in a lot of different settings. What are they, like you said, what are they doing to stay up to date, and are they recognized in their field?
So it goes back to what Jean said about that mentoring. Do you have those connections? Do you have the research? Are you doing additional things to stay up on top of everything? Other comments or questions? Well, we're not going to decide today. No, we're lifelong learners. Like I said at the beginning of this presentation, I was a social worker. I graduated my social work degree a long time ago. And then I decided I wanted to get my master's in, I wanted to do some type of counseling. And so I started my chemical addiction counselor training. And then I worked at a psychiatric hospital. And the medical director said to us, you need to know what all of these medications are if you are working with patients on meds. At that moment, I realized I loved counseling on medications. And so I went to get my PharmD. Well, I probably at that time could have done a bachelor's degree. But I stopped because I made a life change. So when we had that balance of to do or not to do, and there were just circumstances, I chose not to. I went on to live my life and do some things overseas. I just made some life decisions. So I chose not to at that time. But here I am. I have a PharmD. I completed PGY1, and I'm working towards certifications. It just took time. But here I am, and it's completely different. And had I done that 15 years ago, would I be the pharmacist that I am today? So you don't have to decide what your career is today. You don't have to decide today what your motivation is. But have a vision of where you might want to be. Over lunch, I was talking with some residents about that you have to make this decision today. Because, remember, a butterfly was not always a butterfly. You have time to make your metamorphosis. So what questions do you have, Barbara?
Can someone that's BCUPS certified talk a little bit about the cost of that, and not just the initial cost, but the cost of keeping it up if you're going to do this continuing education?
Does anybody want, I can give you the details of it, but somebody else, because it's intense. Here, do you want to?
Go for it. I don't remember the initial cost. I believe it's
$600
$600 a year.
Yeah, the cost is $600 initially, and then, like she said, there's a couple ways you can keep your certification. You can retake the test in 7 years. Or you can do PSAPs, which are about a little under $300, but they're in 3-year chunks. Like the one that's out right now is from 2012 to 2015. So you end up buying 2 PSAPs if you do it that route. Because there's some rules as to how you can do your CE related to it. You can do, I think it's 20 or 30 hours in the first 3 years that you're done, and after that you can do whatever you want. Or you can wait and do all 60 hours in the 3 years before you're doing your certification. So you can do like all of the PSAPs, but they're kind of minding to do them all. So it's 60 hours over the 7 years, but they have to be PSAPs or they have to be, I think ASHP now has some ACPS approved,
Yeah, there's a couple of different.
which
programs
used
apart
to
from
be that
PSAP.
way. It used to be just PSAP, but now they have, you can do it through ACPP or you can do it through ASHP.
Yeah, there's some live programs, and then I think some webinar-based programs too that function with the CE. And then it's $100 per year just to maintain apartments. Yes.
So in a lot of these certifications, like the health information one, that was almost $1,700 to complete that one. There's a cost to most of them to apply and then to re-certify yourself. And each of them have lots of details, which on my slides that you can download from MPA has the sites that you can go into to see a lot of these, so that you can get more of that information. Because it is changing all the time. What other questions do you have? Who's just ready to go home? You guys can raise your hands. I'm not gonna- Any questions?